Hi, my name is Paul Blane, and I am the founder and CEO of Competence. I'm just doing these very short webinars, basically bringing a little bit of insight and knowledge to you in relation to competency assessments and the importance of these within health and social care. So today's topic is very much competence in health and social care. Why do we need to do it? Who's asking for it? And what benefits can we get from it? So there's a couple of slides that I'm going to take you through, which will hopefully take you on this journey that we look to go through throughout the course of the next 10 to 15 minutes or so. So, as someone who's been highly involved within education, within health and social care, I'm also the founder and CEO of CBAT, Care Business Associate Training. It's become very apparent the role that competency actually plays and why the regulatory bodies are asking to see more of it. You see, within the new single assessment framework, CQC set out within their guidance to ensure that not only were staff being trained, but observational practice and evidence was being shown to be able to prove to them that the training that people were having was effective and working. Now, if you're like me, when I was a manager, when someone says to you, you need to write a competency assessment in this area, let's say it's the field of infection prevention control or moving and handling or your fire drills, you tended to jump onto Google and see what was out there because there wasn't really any clarification. There was no framework set up with skills for care or skills for health. So you were pretty much on your own. And what actually is a competence? What is it that we're actually looking at when we look at observational practice? And how can we demonstrate that to the inspection bodies when they ask during your inspection time? So today's run through is very much to showcase exactly the answers to those questions that I've just asked myself and asked of you. So as I mentioned, my name is Paul Blane, and it's myself that will take you on this journey today. So as we move on to the next slide, first question, what is competence? Well, competence is the ability to perform a particular task or skill effectively. Our competencies that we've built, so we have a huge competency library within Confident Competence, is to help teams develop that knowledge and skill and show their behaviours towards it so that you can be assured that what they are doing is the correct process and procedures. So within a competence, we are very much looking at skills, so practical skills and practical assessments. So it's important to realise this is an academic. This is, you've done the study, you've done the learning, now can you put it into practice and can you show us how that works effectively on the floor? To do that, you're going to have to have an understanding and knowledge around what it is that you've learned, which is how we rationalize it and justify it in the role that we have, a working role. And then the third component to that is attitudes and behaviors. So where we put individuals at the heart of what we're doing, because we're no longer doing this in classroom practice, we're doing it in real life scenarios. We're taking that skill and showcasing it into the work that we do. So that's what we're looking at when we look at competence. Now, one of the easiest ways that I can explain this to you is to look at the conscious competence model. It's a great model, simply down to the fact that it takes us through the route of how we become competent as humans in any skill that we have. It doesn't even have to be in health and social care. The ability to learn to walk, to talk, to brush your teeth. Let's look at that last part. So when we first start off with what's known as an unconscious incompetence, now that's not me being rude. So it just means that there is a skill and I'm not aware of it. So when I was born, I wasn't aware that I would have to brush my teeth. So therefore, I'm completely oblivious to it. And there's a lot of people that come and start work within health and social care that discover very quickly a lot of skills that they were unaware of in the first place or when they took on the job role. So that's what we class as an unconscious incompetence. We then move into the area where we do actually realize there is a skill that we lack, but we are aware of it. And that's when we know that we're consciously incompetent within that area. So I know that I have to do that, I just don't know how to. And these are the journeys that we take in everyday learning in life. When we discover new things, we move into conscious incompetence. When we actually start to move into becoming more competent, so we're consciously becoming competent within that area, it means that we're actively working on that skill. It requires a lot of thought. You know, if someone teaches me in a classroom how to use a hoist, then I'm not going to be an expert level in using that hoist the first time that I start to use it in real life practice, which is why we do things like cascade learning, working with someone who is more experienced and more familiar within using that piece of equipment. So I'm working towards becoming competent at this point. And that leads us on to the part, well, what really is competence? Well, competence is having a skill that you no longer even need to think about. You just do it. So let me take you back to that first scenario that I talked about, the brushing your teeth. So I started off not aware of it. Then I see other people brushing their teeth, or I have my mom or my dad or other form of parental guidance saying to me, we need to brush our teeth. So now I become aware that there is a thing called a toothbrush and there's a thing called toothpaste. Then, through active learning and active practice, I start to learn how to brush my teeth. So that can be, am I brushing it for 2 minutes? It can be along the lines of, am I making sure I get every tooth? Am I getting the tops of my gums? You're practicing this to become competent. And then at some point, you can just do it. You don't even have to think about it. You don't have to count your teeth. You don't have to time yourself anymore. You know how to brush your teeth and when your teeth are brushed. Now, how many people in your workplace would you turn around and say at that point, they're competent in that skill? They're really competent. They don't even have to think about it. They just know how to do it. And that's the key bit when we're looking at competency. We're looking at people, first of all, do they know the skill? Second of all, are they aware of it but don't know how to do it? Third, are they still practicing towards it, so they're giving it a lot of thought? Four, are they completely competent in that area? And if they are completely competent in that area, then why would we reteaching them things that they're already competent within? We would try and move them on to the next stage. And that's what we call the conscious competence model. And if you think about health and social care, there are so many training courses that your staff do. And ultimately, you've got to prove that they're competent, that they're working with competence. So when we built this system, we based it very much on Miller's pyramid of competence, which is another model that forms alongside the conscious competence model. So we are looking at 4 different levels there that takes us up to what we call expert. So from novice to expert. And again, you can see it requires knowledge, skills, and attitude. You've got that little line that goes down the side. So the first one is a fact recall. So we know how it should be done, or we know what it is. The second level is we know how to do it. So we have an interpretation and application. So we've done our research, we've done our learning, we've had our classroom discussions, we've been able to watch it being done, we may have been mentored, we may have been coached. So we know how it's meant to be done. So we know of it now, and we've moved up to knowing how it's meant to be done. Then we move up to the next level when we're looking at a competence approach. We're able to demonstrate it. So we're now able to show in simulation how we are capable of doing it. So we've taken the understanding and knowledge, and now we're putting it into practice. To get to the top level, to get to what we class expert level, we just do it. So this is performance in practice. We just know how to do it. And that's what we call direct observation, work-based assessments. And that's where competencies come in. Because when we competency assess someone, we are looking to see where they sit on this pyramid. And we're always trying to move them up to that top level where they can just do it. So that's what we call Miller's Pyramid of Competence. Now, in building our system, we've created a 5-star rating system. And obviously, if it was someone getting judged at 1 star, the likelihood is they're on the lower level of this pyramid. So they are hitting the nose that it's something that they've got to do. But they're a complete novice at this. To get to expert level, that's where they would be getting rated at 4 or 5 stars. So what competencies do we need to do in health and social care? Well, in reality, any training that you give staff, be it for your statutory or your mandatory, you will have to prove to an inspector that you have competency assessed that person, that you've observed that person, and you can evidence that they can do that role and they can do it competently. And that ties in with things like Regulation 12 of the Health and Social Care Act, where it says staff must be experienced, knowledgeable, qualified, competent, and skilled to do the work that you are asking them to do. So think about all the different things in health and social care that we do, from communication, from delivering personal care, to dignity, gaining consent, to moving and handling, to assisting with feeding, to pressure area care. Think of all the different skill sets that you may deliver in training, working in people's best interests. You've got to provide evidence that you've competency assessed this. Now, we've done it for such a long time in areas like medication administration or fire evacuation drills, but they want so much more now. And there's a reason why they want so much more, because it's up to you to prove that your training that you are delivering is effective and working. And that's where they want your proof through competency assessments. Now, in building this system, the key thing for us was to give you a library of all these competencies that you could use. And there is many, many different competencies within the system, all accessible to you. And you're able to complete these competency assessments through an app. So you're able to do it in the same time it takes the task to be completed. So by doing this via an app, being able to do it swiftly and quickly on the floor, and then feeding back into a reporting system, we've built a system that will take the idea of you Googling and trying to write your own competencies away from you and give you the ability to get on with the practice, complete the observations, and showcase to the inspectorates that your staff are indeed confident and competent. This has been a very, very short webinar, and I'd love the opportunity to showcase our system to you, to show you how it can integrate with your training, to reduce down the amount of training that you do. And when I say reduce down, I mean ineffective training. Because if someone already knows the alphabet, why would I just keep every year putting them on training to relearn the alphabet? We just need to show that they are confident and they are competent. So in our system, Confident Competence, we've created a simple, standardized, and effective way in which to do this. So have a look at our website, www.confidentcompetence.co.uk, and maybe book a demo and let one of our team showcase to you this fantastic system that will save you time, energy, and money, and most importantly, it will allow you the opportunity to turn around to anybody and say, we have observed our staff in practice, and we can state quite clearly and confidently that they are competent. The QR code's there. All you got to do is take a look, have a peek behind the curtain, see what you think. There's no obligation, but it's worth a look. And if you are not thinking competency at this moment in time, please start thinking competency. Because in all inspections that are occurring now up and down the country, you are being asked to provide your competency assessments. Move away from a paper-based system. We need to track and trace this. I've been Paul Blane, and I will catch you for another short webinar very soon. Have a great day, everyone, and speak soon.